Well, that's the good news. Thanks so much, Mary Beth. Well, patients with gum disease are getting some high-tech relief. Next in tonight's medical report, see how a new laser technique is easing the pain for local patients. And all new on News 4 at 5:30, a veteran Niagara Falls police officer has been involved in a serious crash with people who were pushing a disabled car. We'll have the latest on the victims. A new laser technique is helping patients with gum disease avoid painful surgery. In tonight's medical report, Dr. Peter Ostro shows us how it's made a difference for patients of one local dentist.
The outlook for periodontal disease just got brighter.
Gum tissue looks really good, really pink.
Rico Garfalo has had serious gum disease twice. The first time he had surgery.
I had the same procedure done with a scalpel about 15 years ago. And then this year I had it done with a laser, and it's just a world of difference.
Serious periodontal disease has to be treated. The gums are reddened and inflamed, as shown in this picture, and the teeth can be lost.
We have to get the bad stuff out of there. Traditional surgery, we cut it out with a scalpel, and we reshape the bone underneath, and we suture everything back together, and we allow it to heal.
But this laser can just destroy the diseased tissue and bacteria, just as it only erases the dark writing on this tube. That lets the gums and bone really heal. It works.
When I first saw Rico, that was all bleeding. It was all red. It was a different color.
Now his gums look normal, and that's a typical result. All Dr. Dolgos's patients have been happy with this procedure, and the laser is nearly painless.
You really don't feel too much of anything. It's just a light sweeping across your gums.
So there isn't a need for sutures, and that prevents the bacteria from getting back down into these pockets, allows the bone and connective tissue to grow up from underneath.
I'm very pleased with that. It was minimal discomfort rather than pain from what I've heard from the traditional surgery, and it's healing very well, and I'm very happy with the results.
This really is a stunning improvement in the treatment of periodontal disease, and that's a serious disease. You know, besides losing your teeth, chronic infection of the gums is also linked with a higher risk of having a heart attack. So periodontal disease is something to be taken seriously.
You know, and I've talked to a lot of people who've had the surgery done, not what you're showing here. This looks like a great advance. But how do you know if you're a candidate for this?
Well, some people have typical symptoms. The most common one probably would be if you bleed when you floss your teeth, okay? Or sometimes people would have a persistent bad taste in their mouth. An early case might not have symptoms, but a dentist can find it during a checkup, and if the dentist finds it, it can be treated before you need a procedure, either a laser or surgery.
Well, this is good to see. Thanks a lot, Doctor. Stay tuned.